started. This is the homeopathic conference call. We have with us so far Amanda. Hello, Amanda. Say hello.
Hello.
Okay, so we have one person that has actually come on time. As people come on, we'll just keep going, and we're going to record this call so people will be able to listen to it at a later time. So let me get started. My name is Miro Posick. I'm a homeopath. I'm also the owner of Best Made Homeopathic Products. And I do homeopathy as well as a little bit of acupuncture and some other stuff, but mostly I do homeopathy. So I'm going to start off with a quick introduction to homeopathy. Hello, we've got another caller on board.
Hi, yes, this is Matoko calling from New York.
Hi, welcome aboard. We're just getting started, and I'm going to talk about, this is Miro Posick, and this call is being recorded, okay? So we're currently being recorded.
Okay.
We're starting with a quick introduction to homeopathy. Homeopathy is a form of medicine that was developed over 200 years ago by a guy in Germany named Dr. Samuel Hahnemann, okay? Basically, at that time, medicine was a disaster. They were using leeches, cutting people open, giving them crazy amounts of herbs and chemicals, and it was all, if the doctor came to see you, your chance of surviving the treatment were 50-50. They had, and Hahnemann, even though he was a trained doctor and a pharmacist, he said, this is crazy, I don't like what's going on here. So he pretty much got sick of what he saw, and he went to translating medical textbooks and pharmacy textbooks from 8 different languages. And his whole premise was, let's see what kind of a dose we can give someone that's going to have a positive effect, but doesn't have all the side effects of all these other chemicals and minerals and herbs that we're giving people. So he found by diluting it, he was able to get the same effect as from a big dose of the drug. Now, he didn't just water the drugs down. He used succussion, which is impact, and dilution. So he dilute it, shake it really, really hard, and then do it over and over again. Now, most homeopathic drugs are made from plant matter, some animal matter, some minerals. Now they also make homeopathic remedies from different drugs that are available on the market. And it's a very gentle way of healing people, because what you're doing is you're actually using the body's own immune system to fuel the healing. So, for example, let me give you a very, very simple example. If someone has nausea, what will happen is conventional medicine will give them a drug that will push against the nausea, and then it'll work, or like Dramamine or something else. And there's side effects to that. Homeopathically, one of the big nausea remedies is Ipecac. Ipecac is a herb which in regular doses will cause vomiting. Okay, homeopathy means like cures like. So the Ipecac in homeopathic or tiny doses will actually cure the symptoms that it would cause in regular doses. So another example, a very popular remedy is called Nux vomica. Now Nux vomica is used, I call it hangover helper, right? Helps people when they're feeling nauseous, they got the poops, pounding headache. Nux vomica is a very, very well-used remedy. And again, that plant, if taken in regular doses, will cause pounding headache, vomiting, diarrhea, that kind of stuff. So that's the thing. Homeopathy, the whole principle is like cures like. Okay, so that's basically the premise of homeopathy. Homeopathy is very safe. The remedies last almost forever. There's never really any side effects. If you take the wrong remedy, nothing will happen. If you take the wrong remedy over a period of time, then you'll develop what they call a proving. And proving is how they determine how the homeopathic drugs are to be used. So they'd have someone take Nux vomica in homeopathic potency and create a picture of that person. Now, homeopathy doesn't address a specific issue. This is where it's really interesting. Like, for example, I'm going to use the nausea example, right? There's different kinds of nausea. There's some where you're actually throwing up. There's some where you just feel nauseous. Somewhere it comes up to your throat and it stops and goes back down. So when they do the drug proving, they have healthy people take these drugs, take the homeopathic remedies in potency, and they carefully log what happens. And they also log the mental and emotional symptoms as well. So what happens is a homeopathic remedy will have a profound effect on the person's entire being. So let me go to the next step of that. The next thing is acute prescribing versus chronic prescribing. And this is very cool, okay? Because acute prescribing, anybody can do, okay? Acute prescribing is very simple. So, for example, let's say you have the flu, right? When my daughter has the flu, she gets cranky, sleeps all the time. When I get the flu, I get a very high fever, and I just sleep. When my girlfriend has the flu, she has a lot of sinus discharge, she has a really bad headache. So you can't just say, hey, here's a flu remedy, because there's different individual pictures. There's also emotional pictures with that, too. For example, my daughter gets really cranky, my girlfriend gets frustrated, I get dopey. So what we're doing is with a homeopathic remedy, we're trying to find the remedy that's best suited to the whole picture, okay? Another very common flu remedy is belladonna. Belladonna is when the kid has that eyes glazed over, stoned look, and they're just zombies. And that comes with a high fever. And that's a belladonna remedy all day long. And the neat thing with homeopathy in children is a small dose will transform them. And the thing is, if you're using homeopathy on your kids, and you give them a remedy, and they got the flu or something, and half an hour goes by, try a different remedy. It's not the end of the world. You're not going to poison them, okay? I've seen kids will actually break in one of my first aid kits and eat like a pound of remedies and just get the poops. There's no danger here. So if you miss a remedy, try a different remedy. A lot of homeopaths say, oh, you can't do that. You know what? You try it. If it doesn't work, you try a different remedy. It's not the end of the world. Sometimes even myself, I'm trained and experienced. I don't get it until the second or third remedy, okay? Now the next thing is chronic prescribing. Chronic prescribing is a little harder to do because what you have to do, you have to look at the person's entire picture. You also have to look at what are the past mental emotional traumas, what are the past medical history, what is the past health issues, what was the underlying cause of it. So doing chronic prescribing, you really do need a homeopath because very often there's layers of different issues that need to be addressed. So, for example, I had a very long-term case where the case started off with one remedy. We gave him that remedy. And that remedy cleared off all the symptoms. Then a bunch of different symptoms came on board, and we just chipped away at it until we got the person very, very healthy from where they were in terrible, terrible shape. Okay. The next thing we're going to talk about is constitutional treatment. Okay. Now this is the neatest thing. Usually when I talk to people with homeopathy, I say, I'm not going to fix. Let's say someone has a backache. Let's say I have a woman that has a backache, right? 90% of the time, backache in women is hormonal. Okay. So they come to me in their input sheet. They're saying to me, Miro, I have a backache, and it gets really bad during certain parts of my cycle. Okay. Now I can look at it and think I'm going to try to address the back pain, but I'm not going to really try to address the back pain. I'm going to actually work on restoring her balance and her health so that her cycles will go smoother. And then if her cycles go smoother, then her back pain will disappear. So very often it's a matter of, even though it sounds kind of reverse, I have to work on the underlying cause before I go after the individual symptom. So there's a couple of different ways of treatment. Constitutional treatment, which means you're going after the constitution, is the ideal homeopathic treatment. Okay? And with some people, it's easy to do. I had a case a few weeks ago where I treated someone, and a constitution means a certain remedy fits that person's picture to 80-90%. So that means that person has the physical, mental, and emotional symptoms that match that remedy very closely. Okay? So what happens is constitutional treatment will profoundly affect the person's mental, emotional, and physical health. Okay? So let me talk about that for a little bit, okay? So let's say if someone has a very anal retentive personality, someone is very, very particular. So you have someone that's like an engineer, right? So that kind of personality is very useful. These character traits and these skills are very useful. Let someone be a computer programmer, an engineer, a highly technical, highly complex field. They have the ability to pay attention to detail, okay? So that person in balance has a clean house, is very organized, very structured, and they do fine. Now that person out of balance suddenly becomes very anxious, becomes obsessive compulsive with the stuff that they're doing. And it turns into a point where it's interfering with their lives. So there aren't good and bad character traits. There are character traits that are in and out of balance. And constitutional treatment will address those. Now, 90% of what happens with people is emotional. And then you deal with these emotional issues, you'll address the physical ones. So let me give you an example. I had a young lady who was 7 months pregnant. Husband was a drug addict. All kinds of Jerry Springer stuff in her life. And she was having contractions, very, very bad contractions. She went to the hospital. They gave her tributylene. The contractions kept coming. And this was a very real situation for her. She did not want her baby to be born 2 months early. I did the case. I gave her a flower combination, and I gave her a remedy. And within 5 minutes, the contractions stopped. Released from the hospital. She carried a full term. There was no further problems. And it's amazing. So the constitutional treatment is it's the gold. It's really what you want to do with homeopathy. For long-term chronic issues, once you find someone's constitutional remedy, okay, usually you done that remedy for a month or two, and then they kind of take it as needed, because you never actually fix a health problem, because you always have that inherent weakness or that area that needs to be supported. So, for example, I'll give someone a constitutional remedy. They're doing great. Every few months, they may need to take the remedy if they start to feel themselves sliding back to where they were. Now, if they have a death in the family, or they have a crisis or a stressful time in their lives, they will need to get back on that remedy to support their system. Okay? Now, this constitutional remedy sounds like a magical cure, and it's fantastic, and it will transform people's lives. Now, here's the catch. The catch is it's hard to find. Constitutional treatment is easier in children. It's harder in adults. Okay? And here's why. There are over 3,000 remedies. Usually, 99% of the time, I use the top 100 remedies. Okay? In my own personal case, I'm a homeopath. It took me 6 years and 5 homeopaths to find my constitutional remedy. Not that the other homeopaths were, not the first guy was incompetent, but it took a while. I deal with different groups of people as a homeopath. I deal with a lot of, like I'm in an area with a lot of Mexican migrant workers. I love those people. Here's why. They eat well. They don't take pills. Now, when I have my average American client comes to see me, they have a shopping bag full of pills. So for me to filter out which symptom is due to their constitutional type and which symptom is being masked by the drugs makes it very, very challenging. In addition, all these different chemicals have their own interactions with the body. So everything is connected. Everything is connected, and homeopathy is one of the few treatment modalities that does treat the person globally. It actually treats the person in their entirety. But for chronic issues, it is sometimes a journey. And I try to tell people that, see, this is not a magical pill that you're going to take. Sometimes it is, and we have these great miracle cases, but they don't happen every day. So that's what constitutional treatment is. The advantage of constitutional treatment is you're building up the health to such a point that everything else fixes itself, right? Here's another example. I had a young man that was having seizures on a nonstop basis, okay? Took his case and everything else. He had anger issues. So after about 6 months, I gave him the remedy staph. Staph sagarina is a plant, and it's used to treat people's anger. So here's what we did. We gave him the remedy for staph. The staph remedy calmed down his anger. When his anger was calmed down, his digestion improved. His digestion improved, his overall health improved. As his health improved, his seizures disappeared. He hasn't had a seizure in 5 years. So that's constitutional treatment. Okay. The next thing of treatment is treating what you see in front of you. So, for example, you do a lot of that in acute prescribing. You have to say to yourself, okay, this person has debilitating headaches. Now, there's 500 pages of headaches within the books. Finding the right headache remedy takes a little bit of work. But very often you have to treat what you see in front of you. Another example of treating what you see in front of you is a first aid situation. So A few months ago, I'm in my bathroom and I'm picking something up, and I stand up really quickly. Now, I'm 6 foot tall. I'm 200 pounds. I stood up so fast, I hit the top of my head on a cupboard door that was open. I actually tore one of the hinges off the cupboard, opened the top of my head, almost knocked myself out. And the entire bathroom was looked like a crime scene. There was blood everywhere, and I almost butchered myself. So what do I do then? Arnica, any kind of injury, impact to the head, to anything, any kind of injury, bruising, arnica, arnica, arnica. If you have no other remedy in your house, have arnica in your house. Okay? Next, any kind of head injury, any kind of injury that may have shaken up the brain. Any person that has ever had a head injury in the past, either traumatic injury or even like a mild concussion, remedy is calc sulf over a period of time. So, right away, arnica for the injury, arnica to stop the bruising, arnica to help it heal up. Next, calc sulf, help restore the brain. Now, I had a guy that was in a coma from a catastrophic brain injury, and we gave him calc sulf for months and months and months. And this guy's talking and walking, and they said he'd never come out of it. I mean, it was an amazing case, but it just took so much time. But yeah, if anybody in your family or you have any kids that have had a head injury, calc sulf, calc sulf, calc sulf, and give to them for like every day for at least a month, and you'll see an improvement. It's also interesting is people that have had head trauma, they have some cognitive impairments. They'll not say the last part of a word. When they're writing, they won't write the last couple letters of each word. There's all these little things that people with head injuries do. And after this treatment of the calc sulf, that'll disappear, which is kind of cool. Okay. So next thing, dosing and frequency. Okay. Here's some quick rules of thumb. Children under 10, your dosing is going to be 6C. Okay. Children 10 to adults, your dosing is 30C. If you're treating something constitutional or acute, 30C once a day is fine. Okay? Now, if you have a really, really bad flu level, like if you have a very, very strong flu, go to 200C or even a 1M. So the main ones you'll see on the market are 6C, 30C, 200C, 1M. And these are different dosages. Okay? Next, frequency. As you become familiar with homeopathic remedies, you'll be able to feel the shift. So after a few months of treatment, you'll get to know when you need the remedy. You'll actually know when you need the remedy. And the kids will come say, "Look, I feel crappy again." Like I had an 8-year-old daughter. She had a really bad case of the flu. I knew she needed Nux vomica. I ran the case. I gave her a 30C. Nothing. The flu was brutal. She was stuffed up, zombied, couldn't move. Gave her 200C. Half an hour goes by, nothing. So I give her 10M. 20 minutes later, she's running and playing and wants to go to grandma's and hang out with the other kids. No problem. So you're not going to, if you give a small child, I wouldn't say, hey, start with a 10M, but those are the options, and that's how you do the frequency. The biggest thing is just if it's a very, very strong flu or a strong acute state, you give a higher dosing and you do a frequency. If you're trying to deal with a chronic issue, like if someone says, Miro, I have depression, I'll run the case. I'll give them a 30C every day for a few months, one time a day. If they've just been in a car accident, I'll give them arnica, 200C, 3 times a day, 4 times a day, maybe every hour, depending on which state they're in and how far they are. Okay? Does that make sense? Hello?
Yes. Sorry, I had muted my phone just so that I didn't have the background noises.
Okay. Am I going too fast, or is it making sense?
Nope, makes perfect sense.
Okay. I'm gonna go back on my lecture here. Okay, I'm trying to cover all the stuff so we'll have more time for questions. Okay. Next on the agenda, changing remedies. I don't recommend changing a remedy 30 times. Okay, but it's okay to experiment. If you don't get the first remedy right, try a different remedy. If that remedy doesn't work right, go ahead. Try a couple. You're not going to hurt anybody with it. Now, it's this is a big thing. There's academic homeopaths and there's practicing homeopaths. Academic homeopaths are saying, yeah, you have one remedy, one dose, And if you're the right homeopath, you're going to find the remedy the first time, you're going to find the dose the first time, and it's going to be perfect. And that, in actual practice, is crap, because some people are very sensitive, some people aren't sensitive. I gave a guy a remedy for prostate issues, and by all indications, the guy wasn't sensitive, no problem. I gave him a remedy, fixed his prostate, top to bottom. He had little red dots all over him. He was not happy. Now, in homeopathy, that kind of reaction is good because it means that you have toxins being expelled from the body. So tell him just relax, wait it up. Sure enough, the dots cleared up after a couple of days, and the guy went like 8-9 months without any prostate issues at all. So he came back. I gave him a lower potency next time, and he takes remedy on an as-needed basis. So it's okay to change remedies. It's okay to change the dosing. Don't go crazy, but don't. You will see materials written saying if you don't get the right remedy and you give someone the wrong remedy, they're going to die. That's crap. Okay? The reason homeopathy is so good because it is so safe. The only danger in homeopathy is this. If you give someone the wrong remedy over an extended period of time, you will create proving symptoms. So they will start proving the symptoms of that remedy. So that's the biggest thing. Okay. Now the next topic I put on here is using combos. I sell combos a lot. And the reason I sell combos, and I use them in my practice as well, is it depends on the situation. If someone has a specific health issue, that is very often addressed very well with a combo. And it'll give me the results that person needs right away. It's not always easy to take someone that's, like, for example, I had a client that had leukemia. They were doing chemotherapy, doing all this stuff. I couldn't really support them using conventional homeopathy. So I gave them a combo. The combo was the cleansing one, number 5, for cleaning out the liver, getting the toxins out. So just giving that combo, that patent formula, gave them a lot of support, okay? Next time I'll use a combo is in kidney issues. There are a couple main remedies for urinary tract infections, that kind of stuff. And any kind of systemic issue like hormonal issues, menopause, urinary tract infections, this stuff is so amazing with homeopathy. In my town, there's a urologist that's going to have me killed because all these women have had the same pattern. Urinary tract infection, go see the doctor, get antibiotics. A few months later, it comes back, and they just follow this pattern over and over again. Whereas with homeopathy, you can cure that stuff in like 2 hours. It's so amazing. So in hard cases of kidneys and urinary issues, if it's a tough case, I'll give the combo. Here's why. The combo contains Berberis vulgaris, which is usually given in a tincture form. It's an amazing herb to clear the kidneys and support the bladder control and support the bladder. The patent formula works so well because it has this in there, and also has in a couple different individual remedies in there. The results are amazing. So I'm a classical homeopath, but more than that, I am a homeopath that looks for results. I'm very pragmatic. If rubbing dog poop on somebody's head is going to fix them, I'll get some dog poop and I'll do it, right? Next issue is diet. Diet is so crucial to people, and they don't really. The longer I do this, the more I see the diet's important. So absolutely, number one thing I say, take the gluten and sugar out. Start with that. Next, take out the food and preservatives. Next, after that, is take out milk products. And different people have different sensitivities. Now, I also do allergy treatments that I use an acupuncture machine for. Funniest thing, when I treat people for allergies, I always test to see what foods they're weaker on and stronger on. Ironically, many people are actually stronger with red wine. So whatever you're eating, add red wine to it, because that seems to be helping everybody. Okay. Now, next we're going to talk about stomach issues, food absorbing, thyroid issues, hormones. So let's start with stomach issues. Digestion is a series of interconnected and interdependent chemical reactions. Okay? So what will happen is anywhere along the way, there's going to be a problem. Number one cause of stomach issues is antibiotic use. Number two source of stomach issues, emotional concerns. Remember what I said about constitutional prescribing. We need to know what's going on, because Stomach issues, a lot of anxiety lives there, a lot of anger lives there. So stomach issues are very treatable with homeopathy, very supportable with homeopathy, but you've got to look at the whole picture. I can't just sit there and say, hey, you know what? You've got, you have IBS. IBS is a ridiculous diagnosis. It's a collection of vague stomach issues, and they give you medication for it that just makes it worse. Here's a little interesting tidbit. A lot of people are diagnosed with having too much stomach acid. The symptoms for too much and not enough stomach acid are exactly the same. Now, how do we differentiate the two? Easy. On an empty stomach, have the person drink a quarter cup of apple cider vinegar. Okay? Here's what's going to happen. If they have too much stomach acid, they will get crazy nauseous. Now, if they don't have enough, they'll actually feel better. So here's a test that you can do with your kids or yourself. It's going to cost you probably like $1.50. You do it at home, and you'll know exactly where you are with your stomach acid, because all they do is they throw in Zantac and Prilosec, and these things just often make the problem worse. Okay? Next issue, food absorbing. This is a combination of allergies, food allergies, reactions. It means that the system is in a state of inflammation. How do we support that? The biocombination, the cell salts, are amazing helping food absorbing. There's different remedies. And again, if there is a chronic food absorbing issue, we go back to constitutional treatment. We'll do a full classical case, and we'll look at that, and we'll deal with it, because it's very often bacteria imbalances. Now, here's where it gets interesting, okay? I'm not a big fan of supplements. The probiotics, I think, are great for reintroducing bacteria in the system, okay? But there is a primary imbalance in the digestive system that is not allowing the environment for the proper bacterial balance to grow. So homeopathic treatment, in cooperation with probiotic treatment, will help restore that balance. But you can't just sit there and say, look, I'm going to take these supplements. 90% of the time what happens with people, they have a health issue. They have headaches. They have too much pooping, not enough pooping. They go and they take medicine for it. And what happens is the body develops a resistance to the medicine. Then they have to increase the dosage. I see this a lot with constipation. Constipation is a huge thing that I treat on a regular basis. So what happens? I had a lady client that was actually a pharmacist, and she was at a point where she could not make a bowel movement without an enema. Okay, so we started homeopathic treatment, and within 3 or 4 days, she had a very nice regular pattern. Okay, she's been under my treatment for 1.5 years, and she's doing amazing. Okay, how do we do it? I use the patent formula to help her get her through the first few months and get her health. Again, we're trying to build health. We're trying to build strength. Then I changed the plan over from a patent formula, a combination formula, over to a single remedy. But I had an immediate and specific problem I wanted to address, and I also wanted to get her away from using all the harsh drugs and enemas she was using where she was there. So, like I said, I'm a practical homeopath. Okay. The next one, thyroid issues, hormone issues. These are big topics. Okay. There's a lot of adrenal fatigue out there. Now, I'll tell you a funny thing happened. Okay, and this is such an interesting topic. I had a program starting about 10 years ago where I would give people a diet for candida, and the diet was terrible. The diet was absolutely no sugar, a little bit of fat, and the idea was you starve out the candida, and it was a miserable diet. The diet was miserable. As the candida died off, it would make the person miserable and cranky and everything else. But people did really, really well with this diet. And about 6 years ago, I got in this weight loss. I went to this seminar on weight loss. This chiropractor did this diet, and the diet's very similar to my candida diet, but he took it down to 500 calories. And we gave a homeopathic remedy to support. So I would sit there and say, okay, look, these people want to lose a lot of weight, and here's what we did. So we put them on this 500-calorie a day diet with the homeopathic remedy for support. And the diet was very restrictive. No chemicals, no sugar, no fat. It was very simple meat and veggie diet. That was it. We had a vegetarian version, which was basically some vegetable protein, and that was it. I mean, it was the diet's terrible. So people be on this diet for basically 21 days. A couple of interesting things happened. Number one, Most people that follow the diet program lost a ton of weight. I had some big guys lose 40, 50 pounds. The average woman lost at least 10 pounds. The average guy lost at least 20. I mean, it was amazing, okay? But a couple of funny things happened. First of all, a lot of the women that I got were 40s and 50s and 60s, and this diet reset their thyroid and hormone levels. They got their energy boost back. I had some prediabetes ones that rectified themselves, but it reset their hormone levels. So that was one unexpected side effect. Okay, so they lost a bunch of weight and their hormone levels are reset, and they're able to keep the weight off. Next interesting thing that happened, a lot of these same clients had a lot of depression and anxiety issues. So what happened was resetting this diet, resetting the thyroid, clearing the system, getting all the toxins out, actually seemed to cure a lot of the depression issues. And I had a couple of depression cases on my plate that I couldn't move, and I said, look, let's do this diet because now you've got diabetes, you got stuff going on, and it was spectacular what was going on. So that was a very interesting way of approaching thyroids. But there are different support supplements that will support the thyroid, that will support hormone issues. But if there are hormone issues, they're very, very treatable with homeopathy. Homeopathy is so good at that, whether it's, menstruation issues, menopause. I call myself the master of menopause. I live in a community where the average age is 300, so I see a lot of menopause clients. But this is just homeopathy. Constitutional homeopathic treatment is so good for this kind of thing. Okay. The next issue we have on the agenda is teeth. Now, we're seeing a lot of rotting teeth in children. Now, the best way of dealing with those is cell salts, calc 4, calc phos, and just those are the cell salts that really are there, are a good way to go. I also have a couple combination remedies, but again, you have to look at the whole picture. Is that the only issue that's there? If there's other health issues or mental emotional issues, we do constitutional treatment. Like I said, the constitutional treatment will very often solve a problem that, it will, I don't know how to put this, it will solve the other problems eventually. Once you build the foundation and get that person's energy back into balance, they can absorb their food, they can absorb their nutrients. The nutrients and minerals can go where they need to go. And that's really the key to the whole health thing. Okay? Now, does somebody want to run an acute case with me? I'm opening it up for questions, and if anyone wants to do a case right now. Hello?
Hello?
Go ahead.
I have a question. So,
okay.
It's funny that you were mentioning the pooping because it's like all of those things. I feel like everything revolves around that nowadays. And I'm wondering what other, besides all of the dietary changes you mentioned and such, in an infant, a toddler who's never had any bowel issues, if there's anything homeopathically that supports that.
Okay, so you're saying there's constipation currently, or
it's not constipation. It's just slow bowels. It's like an every other day bowel movement when before it was usually 2 to 4.
Okay, let me do a quick case for you. And what I'm going to do is I'm going to ask you a series of questions and say yes or no to them, and this will kind of give you an idea of how homeopathy works. Okay, so I'm going to hit. I have a software program I'm going to use here and let's see. Here we go. Does the child get an urge to go but cannot go?
No, he goes when he needs to go.
Okay.
There's no not going.
But there's no urging or desire at all, or only when he needs to go?
No, only when he needs to go.
Are the stools too hard or dry to pass?
No, they're loose. They're still a combination of breast milk, so they're normal, loose. They're not hard.
Okay. Did this come on after a stomach upset of some kind?
Yes.
Okay.
Around the same time he started to vomit. He was having like a stomach bug.
Okay. Does he also have piles, hemorrhoids?
Ooh, I don't know. No, I don't think so.
No. If you have a toddler that has hemorrhoids, you know about it.
No.
Okay. Does he get constipated when he's upset or depressed?
No, he's never been constipated. This is like the first time he's
Okay.
showing.
Does constipation alternate with diarrhea?
No, not really. It's hard to tell because their breast milk still kind of poops.
Okay. Okay, the first remedy that comes up for this would be nux vomica.
Okay.
And how old is he?
20 months.
20 months. I would give him a 6C of nux vomica, maybe once a day for a week, and see what happens.
Okay.
Your second choice remedy, okay?
Yeah.
Your second choice remedy for that will be bryonia.
Okay. I have a question. If I only have ever given him 30C, because all I have is 30, I didn't really know that there was a difference between 6 and 30. Could that be why perhaps maybe it doesn't work? Is it possible for you to start too high of a remedy?
If you started too high on them at 20 months at 30C and it wasn't the correct remedy, you might have a small aggravation, but for kids that small, I like to start at 6C. 6C is a really nice. It's a nice one for small kids.
Okay. Thank you.
No problem. Any more questions? That's it? Wow. I must have covered everything.
I guess I'll ask a follow-up question. Just another question that I have. Sometimes I feel like it's hard to know to pick the right remedy for certain things. And like for a layperson, do you recommend like people consulting with a professional homeopath first to find out what remedies they tend to use most often, or just like picking from a hat sometimes and trying them out?
A funny thing happens, okay? What you'll do is, I put on there about a book that has these great cartoons on different remedies, okay? And what you do is you can look up different remedies and see, you'll read remedy, like for example, headaches. Well, there's 500 pages of headaches, right?
Yeah.
So you have to look up headache, and you got to fight with it a little bit. And sometimes you do pick it from a hat. Really, what you'll do in any situation, there's 2 or 3 different remedies that usually come up pretty strong, right? Like I have a software program that gives me a series of questions that I ask, and there's a lot of resources out there. There's a lot of charts you can get. There's some great books. Miranda Castro is a friend of mine, and she wrote some great books on basic prescribing for families, and I absolutely recommend one of her books because she'll cover like the top 30 or 40 remedies. You don't need 3,000 remedies. I mean, if you have the top 50, 60 remedies in your house, you're in the game, okay? You can treat a lot of different stuff with those remedies. In the course of the discussion, I've maybe talked about 8 or 9 different remedies. And, if you know one remedy, if you know a couple remedies really well, you can do it. And the neat thing is, each individual person has a resonance with a certain remedy, or they have a certain pattern, right? And once you find out that pattern, you're done. Like, my daughter does very, very well with Gelsenium. So when she goes camping, I send that one remedy with her because 9 times out of 10, that's the remedy she needs. Does it make sense?
Yeah, no, it does. I think I feel like I have 40 remedies in my house that I've tried once that either I haven't had success with, so I save them and I try them again. And I don't know. It's just a learning process, I guess.
Well, it's interesting. If you look up remedy in Google, right? I mean, there's ABC Homeopathy has a huge website. There's hpathy.com, which is the biggest website in the world for homeopathy. You start looking up different symptoms, and you should be able to find something. Now, if you have a quick and dirty, you think, hey, I have this going on. It's not that complicated. Acute prescribing, you're intimidated by it, right? But there's all these little flow charts and stuff you can get where it's like, okay, my kid is sick. Do they have a fever? Yes or no? And then you go to the next level, and you do these little logic charts, and you'll find a good remedy. And what'll happen is, let me give you an example. There's like 4 different remedies for pooping: nux vomica, Colosynthis, lycopodium. There's all these different remedies that kind of overlap. So even if you don't get the perfect remedy, if you get close, you're in the game. You can do a lot if you get close.
It's good to know.
And like I said, you just trial and error. I mean, if you try one remedy doesn't work, here's the thing: in a child with the flu or in an acute state, okay, you should be able to see, especially with a 60 or a 30C, in 20, 30 minutes. If you don't see a shift in that child, you don't have the right remedy, okay? And that's the neat thing. I mean, I love having kids in my practice because it blows people away. Because the kids don't have 40 years of medications, chemical exposure, emotional problems that all of us adults in America have, there's nothing between them and the remedy. So they get that instant hit from them. And I'll tell you, I've had kids that were like, 106-degree fever, they look like zombies, give them a remedy, 10 minutes later, they're running in the yard screaming. I mean, it is unbelievable the amount of impact that you can make with the remedy. So that kind of, I mean, off the bat, I'll tell you, first aid stuff, you absolutely need to have your arnica for first aid. Any kind of impact or bruising, arnica. Any kind of nerve pain, like when you pinch your finger or something, arnica and hypericum. Hypericum is for nerve stuff, right? Kids hurting themselves. Cuts and scrapes, calendula. The calendula ointment I have, calendula and tincture, awesome for outside use. Burns, Utica urns, catharsis. Those are for burns. Any kind of eye injury, aconite. Aconite they call it arnica for the eye. Any kind of injury for the eye, you start aconite. Now, here's another quick and easy one. Okay, you have these quick onset flus. Where 1 minute they're fine, next second they're sick. Aconite. If you can get aconite into the kid when that flu first starts off, the aconite will very often just reverse it and cancel out the whole cold flu thing going on. So there's all kinds of stuff. I mean, there is a lot you can do with homeopathy without spending any money, and that's the neat thing too is, if you look at what happens with regular kid stuff. Oh, my kid's got an ear infection, right? So you go to the doctor. You get you get an antibiotic. You spend all this money on antibiotic, and what do you get? You tear up the stomach, and you haven't accomplished anything. But earaches are easy. Aconite, echinacea, you put in there. You also you take those remedies. Mag-Phos, any kind of pain situation. Mag-Phos cell salt, 6X, great for pain. Arnica is great for pain. Take kids to the dentist. They have any kind of injury to the teeth. Arnica. Arnica is one of the things you should have in your bag all the time. And there's a whole bunch of stuff. I mean, it's so powerful. But like I said, a little bit of reading and you can do a lot. If you have any chronic health issues, I recommend sitting down with a homeopath and doing a whole case. And sometimes it is a journey, but you can do a lot with it, and it'll affect your health in a very positive way. Bedwetting, anything. Like I tell people, I say if there's any health issue, no matter how weird it is, I probably have a remedy for it. Also, do you have any pets?
Dog, yes.
Homeopathy works on animals. It's safe.
How do you know symptoms on an animal? Like how do you know?
Well, it's actually easier if you know the animal. Like for example, the dog's really hyper and the dog is just kind of sitting around listless. That's a symptom, right? If the dog's been hurt, that's a symptom. I don't do very much with animals at all. And one of my good friends we had a tropical storm down here about a year ago. And they had a bunch of horses that were injured by, falling branches and stuff. And the vet was like, they called the vet and the vet said, look, I've got like 800 animals I have to go see. You're on the list, but I'll see you like next week kind of thing, right? And I went over there and I gave a bunch of arnica and I cleaned some of the wounds. I did my thing. And by the time the vet got to see them, the vet's like, why'd you even call me? These animals are perfect. And it was the same thing. Just you work with what's in front of you. It's kind of cool. Who's on the line here? Amanda, is that you there?
Yes, it's Amanda.
Okay. And there's nobody else on this call? I hear crickets. Okay.
Yeah, sorry, I had my mute, but I had a question. I don't know if you can answer it, but I've worked with a couple of different homeopaths, and I was just wondering, what kind of, what is it more the questions they ask or intuition? Because I feel like for my kids, I've gone to two different homeopaths, and they give different remedies.
Okay.
And so I'm just wondering, how, I guess it's hard to say because regular doctors all get the same training, but they practice differently. But what makes a homeopath, how do you differentiate between not a good and bad, but how can you tell because obviously you studied the same thing, and I guess I'm assuming when you go to study homeopathy, but what makes a person prescribe a different remedy from another person?
And who's asking this question? Just so I know the name.
Oh, my name is Motoko.
Motoko? Okay, thank
Yes.
you. Here we go. This is really interesting, okay? Classical homeopathy, just to give you a rundown of how we do this, okay? There's two books, okay? One is called Materia Medica, and what that does is the Materia Medica describes the individual remedies, and it will outline the symptoms and mental emotional states that are covered by that particular remedy, okay? The second book that we use is called the Repertory, okay? And the Repertory will outline symptoms, and it'll give you cross-reference remedies. So if I look up, let's say I look up constipation in the Repertory, it'll bring me the different symptoms. It'll bring me up a list of, let's say 15 or 20 different different remedies. Then I'll go into Materia Medica, look up those remedies, and see which one fits the case best. Now, a lot of homeopathy is very subjective, okay? And there's different schools of thought. So they have a lot of different schools. There's one guy who I personally didn't like. He developed this thing called the sensation method. And he would ask his patients, do you feel like a plant, an animal, or a mineral? Right? And he would use that to further narrow down the group of remedies. I never liked that particular school of thought because it didn't resonate with me. I'm a practical, hands-on guy. A lot of people come to homeopathy, they've done a lot of they've done a lot of other types of modality. A lot of them, are intuitive healers and that kind of stuff. And those intuitive healers are intuitive sometimes with certain people. With people that we resonate with, they can do some great results with. The hardest part with homeopathy is you can put 20 people, you can put 20 homeopaths on the same case, and they'll come up with 15 different answers. And a lot of it's so subjective. So what I try to do in my practice is I try to, first of all, I understand that the remedy is going to overlap, and then I'm also going to understand that I may not get the right remedy right away. And sometimes you'll see something that somebody else won't. I went to a seminar, and the homeopath that was holding the seminar was really an amazing, amazing healer. He was a medical doctor, neurologist. The guy was a psychologist, and he was just amazing. And then what he would do is he plays little mind games with people. Like, he'd move forward to touch them, and if they backed away, that was one of the symptoms that he would use in his analysis of the case. I know I'm being really vague here, but there's a lot of different ways to do homeopathy, and people have developed different ways of getting there. What I do is very, very simple, straightforward prescribing. I will ask people for big general symptoms: location, sensation, modality, amelioration. So what I'm saying is I'm asking them, okay, what's your problem? What makes it better? What makes it worse? And then I'll ask for these big symptoms. And I'll try to get a whole picture of it. I'll put those in my computer program, and then from there, I can turn around and find a remedy, or at least find a top one or two choices of remedy. And it usually works out pretty well. Does that answer the question, or did I talk in circles?
No, I know you did. I think, yeah, I mean, it's just interesting, how you said if you give the same case to different homeopaths, they would go about it differently and might come up with a different remedy. But
Now let me talk about something else too. There's something else in homeopathy called miasms. Okay. Now remember, we have 3,000 remedies to choose from in any case at any moment. Okay. So we have 3,000 remedies to choose from, and across probably 200 different levels of potency if we want to get technical. So how do you choose the right one, right? So when I do my analysis, I'll usually come up with 2 or 3 top remedies for that particular case. And some people are simple. Some people will sit there and give you a case, and you're going to knock it out of the park. I love the Spanish people. Like I work with a lot of these migrant workers. The language barrier actually helps me do the cases better because there's no room for fluff. There's no room for interpretation. They're just, they have to be blunt with me because, they don't have that many words. They're not trying to craft an image or a perception of their character. They just have to be blunt with me because there's no other way we're going to communicate. So the language barrier actually helps, and it sounds kind of weird, but it actually helps. With those people, when I do single remedy prescribing, I knock it out of the park. 85% of those cases, I'm right on the first remedy, right away. Other people, depending on how much drugs they take, what their history is, how closed off they are, there's a lot of interfering causes. Okay, let me give an example. I had a lady a couple of years ago. I did the case, could not budge this case. We changed her diet. We changed all the stuff. We gave her remedies. I mean, everything. We could not budge the case. So one day, I'm in 7-Eleven. I see her at 7-Eleven. She's having a big gulp, okay? She drank 6 to 8 big gulps of Diet Coke every day, okay? That works up to about 2.5 cups of salt every day. So no matter what I did, or no matter what anybody did, there's no way her issue can be solved because she had been giving herself that much salt. And she was just overwhelming her entire metabolism with this crazy level of salt. Never mind the chemicals and the aspartame, but just the salt. I'm like, oh my God. So I got her off those and everything resolved itself. But that's something she did not disclose in over a year of treatment. Any more questions? Hello?
No, that was very helpful. Thank you.
So, going back to it, diet is so important. Taking care of yourself is so important. Keeping the toxins out and, that kind of stuff is so important. But homeopathy is a good tool. One thing I didn't really start off with saying this, and I want to say it now. If you have kids, and even for your own health, homeopathy should be your first go-to modality. Okay, it should be your number one choice. It doesn't work every time. You don't always find the right thing. Sometimes you find the right remedy, it doesn't work. But if you look at it as a risk-benefit analysis, there's no side effects, no chemicals, no opportunity to do harm. You absolutely should. I tell you this, homeopathy should be your first choice. If you have a pain or if you have something weird going on, homeopathy should be your first choice. First of all, out of just sheer math, it can't do any harm. And like I said, I've seen a lot of cases where weird stuff gets fixed with homeopathy. And one of the things I do in actual practice, when I take an intake form of someone, I will also do a benchmark. It's called a MyMops form. And it's a very simple one-page form where I see where they are. And they'll put down things like, number 1, I have arthritis in my knees, I can't move. I have this, I have this. And they'll put down their top 3 problems, okay? These top 3 problems take the time, energy, and attention, T. So I'll take that form, I'll do the case, I'll give them a remedy. They'll come back in 30 days, and they'll say something like, Miro, I don't know if this is really working that well because, I'm still kind of constipated and, I have something else going on. And I'll pull out their case, and their case said, number 1 problem, rheumatoid arthritis in the knees, I can't even get up in the morning. And that problem on their second, when they came in for their follow-up appointment, they didn't even mention it on their form. So what happens is there's such a gradual and gentle healing that happens with homeopathy. People don't even realize what kind of shifts they've had until I point out the difference in the 2 forms. Or what also happens with a lot of my clients is they'll start the treatment, and then they're like, there's nothing wrong with me, and you're not doing anything, so why should I bother with you? So they'll discontinue treatment, and they'll come back after 3 months saying, you know what, I had no idea how much your treatment plan was helping me until I stopped. Does that make sense?
Yes.
Okay, now let me just cover one more thing, okay? The biggest question in homeopathy and in another medicine is, are you treating or are you curing? Okay? So a cure is a permanent fix, okay? And a lot of homeopaths throw the word cure around, okay? I don't buy into that, because here's why. As I mentioned earlier in the call, most people have an inherent weakness. They have something in the body that will give out under stress, right? Whether it's the stomach, whether it's headaches, whether you clench your teeth, whether, 1,000 things, right? So what will happen is homeopathy can support the system. I can take someone from being, bedridden with fibromyalgia, get them back on their feet, get them running marathons. And I've had people like that, which is amazing, okay? I had a lady in her 50s that could barely walk when she came to my office, and I will honestly take credit for about 10% of her case. 90% of her case was her changing her lifestyle, her changing her activity level, and changing her diet. My homeopathy was 10% of it. I like to think of my participation as just enough to get her, I push her down the hill a little bit, and she did the rest of it on her own. So I'm not taking any credit for her. But here's what we got. We had a person that was crippled fibromyalgia, and within a year, she's running marathons. Okay? 10% credit to me, 90% credit to her. Now, what happened? Her mother died. She had a bad divorce. Whole bunch of stuff crashed down around her in her life. All of a sudden, fibromyalgia symptoms come back. Her metabolism slow down. She starts putting the weight back on. Come back to see me. We give her the remedies. We support her. We build up her strength, and she comes back from it. So, are we going to cure an inherent weakness? No, but we can support it. And once we've gotten to the point where we have the proper constitutional treatment, we have the tools to support that person for the rest of their lives. Now, very often, if someone has 20 or 30 years of health issues, that constitutional treatment is not going to happen the first time out. We're going to go through some layers of it. But what's really interesting is once we get to that point where we can support them, it's amazing. Because then we know, and they know. And they say, you know what? I got a lot of crap going on at work right now. I better start taking my remedy every day. And it's always easier to fix it before it goes into such a negative cascade that it's catastrophic. Does that make sense?
Mm-hmm.
Any more questions?
Nope, I don't have any.
Okay. Amanda, are you still with us, or have you fallen asleep?
No, I'm still here.
Okay. Did you ladies enjoy the call? Did it make sense? Did I go too fast? Tell me what you think.
No, I thought it was great. I thought it was a good overview. And, I think I'm just kind of starting out, and I have a book, and so I kind of think I know how to better use it now.
Just don't be afraid of it, and that's a big thing. One of the homeopathic colleges that I went to, they pushed it hard that if you give someone the wrong remedy, they're going to die, and you're going to be a murderer. And the reason they did that is because they just want to sell more and more courses. There was people within that college that took probably 50 courses and were afraid to give anybody a single remedy. And that's really what I don't want to happen. As a parent, you need to have these tools available, and you don't have to be an expert, but you know what? If your kid's puking and pooping at the same time, that's an ex vomica, okay? If your kid has really, really bad stomach cramps, really painful, arsenicum, you don't need to be a genius to get a couple of these remedies down. There's lots of charts you can buy. I do little charts up in my house, too, and I look and say, we do this here. Right now, I'm working with a programmer. I'm trying to create an app that's going to do, the question answer thing that I did earlier with constipation, that will ask those kinds of questions. Do you ladies think that kind of app would be useful to parents?
Absolutely.
I think so, yeah, because when your kid gets sick, it's hard to run to a book and start reading. So I think that would be very helpful.
But yeah, out of all the tools you have for your health and for your family's health, that little 100-unit homeopathic kit, that's 90% of what you will need 90% of the time. When I sent kids to Haiti, they had 60 remedies in there. They were dealing with a national disaster with 60 remedies at 30C. How amazing is that?
It makes me feel a little bit better.
So now let me ask a question. Do either of you have a materia medica or a repertory?
No.
No.
Okay. Trying to think. Offhand, I would say look up Miranda Castro, and she has a couple of great beginners books out. Start with her. She's readable. She's a good lady, and she's very, very practical. She's awesome. And like I said, she has a couple of these cases. She has a couple of these books that are out there, and they're good. They're very clean. I also recommended this other book that had like these cartoons. I put that on the webpage already, and that's a great book. It's an illustrated guide to remedy pictures, and it'll give you a very graphical picture of what a remedy looks like. Okay, so I'm looking at the time here. Our hour is up. I think I spoke like way too fast and gave too much information, but I hope I was helpful. Ladies, thank you for joining me.
Yes, thank you very much.
Thank you so much.
Yeah, it was. I thought it was very organized because you had a whole agenda and you stuck to it. So.
Well, I'll be honest with you, I really tend to ramble, so I kind of have to rein myself in. I'm going to go ahead and end the call now, but again, thank you very much for participating, and if you have any questions, shoot me an email.
Yeah, thank you so much.